Bismillah ar-Rahman ar-Rahim. Our lecture today will be about uveitis. Uveitis is a common condition that affects the eye. Before that, we must take an introduction. This lecture is part of the ophthalmological lectures for 50-year medical student in Jabir bin Hayyan Medical University. Before that, we must talk about the some outlines that will facilitate the understanding the subject. The anatomy of uveitis, uveal tissue. Uveal tissue is the middle layer of the eye and is composed of three regions, from the front to the back: iris, ciliary body, and choroid. Iris, ciliary body, and the choroid. The uveal tissue is mainly a vascular layer because its main structure is the choroid is mainly blood vessels. Choroid is known in Arabic as al-mashima. The iris is a thin circular structure located anterior to the lens. The iris is thin circular structure located anterior to the lens. Often have a diaphragm that control to the light entrance to the eye, known as the pupil. This is the pupil, the second part. The pupil size normally range from 2 to 5 millimeter, but in response to different environmental and emotional and pharmacological factors will change. When the pupil size gets narrowing, a condition called meiosis. When the condition the pupil size get enlargement, the condition called mydriatic status. So the pupil size controlled by two types of muscle: sphincter muscles, which is lie in the stroma, and these are a group of the smooth muscle cells, stroma of the iris, and joined by tight junction. The size of sphincter muscle about is 0.25 to 1 millimeter wide and circling the pupil. It's adjacent to the contraction of the sphincter muscle caused the pupil to constrict and resulted in meiosis. The muscle is innervated by parasympathetic nerve supply. This is the pupil. When there is contraction of the sphincter muscle, there is decrease in the size of the pupil and result in meiosis. And in reverse, when there is contraction of the dilator pupillae, which is supplied by sympathetic nerves, there is enlargement of the pupil size and result in the mydriasis. The second part of the uveal tract is the ciliary body. All we know that it's a triangular structure located as continuation to the iris. There is a second part, the ciliary body, and approximately from with about 5.9 millimeter. Nasally and at temporal size reach to 6.7 millimeter. The ciliary body can be divided into two parts: pars plicata and pars plana. Pars plicata and pars plana. The largest part is pars plana. The strongest part, pars plicata. The strongest part is the pars plana. The pars plana have part known as ciliary processes that is responsible for secretion of the aqueous and provide attachment to the muscle of provide attachment to the lens. The ciliary body and its muscle groups of muscle have the three groups of muscle: longitudinal, radial, and circular. Those are muscle control and the contraction of the iris and result in change of the shape of the lens, that process known as accommodation. The third part, this diagram show more details. This is the first part. We talk about the iris that lie in front of the lens, and the iris is continuous part with the ciliary body. Ciliary body also have attachment to the lens by zonules, and the third part is continuation of the iris and is known as a choroid. Look like there is, it's composed of mainly of retinal, or mainly composed of blood vessels. As we say, the choroid is the second part and is continuation between the ciliary body and oral serrata in this part to the optic nerve. The choroid lies in the between the upper outer layers, which is called the sclera, and the inner layer, which is called the retina, and its main function to provide of the blood supply to the retinal element of the eye. Now, after this introduction for anatomy, we will go furthermore to the uveitis. So, is الuveitis تعرف as inflammation of any part of uveal tract, iris, ciliary body, and choroid. All those, any one of them, all of them, two of them, if one inflamed, we will call what is as uveitis. The term become widely described many forms of intraocular inflammation, even inflammation of sensory traction, that is to say the retina also. So the retinitis is a type of uveitis. Now we will just take about the classification. We will classify according to the anatomical classification, and then clinical classification, and then etiological classification. Anatomically, we classify uveitis into anterior, intermediate, posterior, and panuveitis. Anterior, intermediate, and panuveitis. Anterior, when there is inflammation involving the iris, or called iritis, or called anterior uveitis, or when there is inflammation in the ciliary body and iris, and this condition called iridocyclitis. Inflammation when occur in the ciliary body and iris, this is called iridocyclitis. As a clinical classification, both of them considered as anterior uveitis. And we judge on the type by presence of the cells. We will discuss the cell later on. The second area, when the inflammation is involving the intermediate part, this is called intermediate uveitis or parsiplanitis. Parsiplanitis or intermediate uveitis. And the third part, when the inflammation is the choroid and posterior part of the eye, and this is called posterior uveitis or choroiditis or even retinitis. And when all those layers inflamed, this is a result in what is known as panuveitis, panuveitis, iritis, iridocyclitis, parsiplanitis, or posterior uveitis, and choroiditis or posterior uveitis. All those, when get together, we classify patient as panuveitis. Another classification is clinical classification. Clinically, we classify the uveitis into acute uveitis and chronic uveitis. Acute عندما تكون فترة الإصابة less than 3 months, and maybe recurrent acute and usually symptomatic. The chronic uveitis, this is usually persistent, insidious, asymptomatic, more than 3 months persistent, and may have an exacerbation and remission course. The third classification is according to the etiology, and we classify uveitis into etiologically maybe idiopathic, which is most common, or secondary to systemic disease, such as spondyloarthropathies, inflammations of the bowel disease, such as ulcerative colitis, Crohn's disease, or secondary to the renal disease, which is called nephritis, or secondary to the non-infectious disease, مثل البهجة disease, or sarcoidosis, or secondary to the diabetes. Also, we classify the infection into what what is an infectious uveitis due to bacteria, and the famous example is tuberculosis, or fungal, and famous example is candidiasis, and viral, and the most common example is the herpes zoster or herpes simplex uveitis. Infestation by protozoa, nematode, and most common type of protozoa infection is known as toxoplasmosis of the al-qibab. And masquerade. Masquerade means there is the infection is another part and hidden as a cause of uveitis, but the eye is involved secondary to other causes, such as secondary to the lymphoma. Exogenous or endogenous factor, systemic infection, infestation, inflammatory, and idiopathic with a specific or non-specific cause. We will discuss later on. Also, this is table more discussing the causes. Idiopathic, about 50% هو idiopathic. Infectious causes مثل varicella, TB, syphilis, Lyme disease, and viral. HLA disorder, juvenile sarcoidosis, Paget, tuberculosis, nephritis, and masquerade to another condition which is neoplasm. This is all called as etiological classification. Now, we will discuss the clinical feature of the uveitis. Uveitis may be acute, and the symptom in the acute يعني المريض يجينا من عنده acute uveitis suspected symptoms photophobia. يجي المريض ما يقدر يواجه الضوء، يقول ما تواجه الضوء يصير عندي ما أقدر أواجه الضوء، أخاف من الضوء، يصير pain، يصير redness, decrease in vision and lacrimation. يعني لن يكون ممكن يصير جزء منهن ممكن يصير، بس تقريبا لازم قسم منهن يجتمعن حتى نقول هالشخص عنده anterior uveitis. The chronic may be asymptomatic or mild redness or floaters. This diagram تقريبا يختصر لنا the sign of uveitis. In this side there is acute stage, and we look as what is known as circumcorneal injection. That is mean أنه the blood vessels اللي around the cornea congested, inflamed. It is called circumcorneal flushing or congestion. And also there is known as keratic precipitate. And keratic precipitate عادة هي عبارة عن inflammatory cells lie from inner part of the cornea and endothelium. نسميه keratic precipitate. ما واضح جدا بهاي الصورة، بعدين إن شاء الله نعرضكم إياه. السيلز، احنا اهم شيء عندنا باليوفيتس عندنا شيء نسميه مصطلح سيلز اند فليرز. السيلز هو عبارة عن الفلوتينج سيلز، عبارة عن floating cells or inflammatory cells in the anterior chamber. And we will calculate the number of the cells to say this is a case of this picture. This is severe circumcorneal injection. Circumcorneal يعني إذا تباعون أطراف العين clear تقريبا، بس الcongestion صاير around the cornea، هذا نسميه circumcorneal flushing or congestion. The keratic precipitate, which we said about, and the presence of the cells that aggregate to the endothelial part, inflammatory cells, and when inflammatory cells are floating in the vitreous, these are this is and cells in the anterior chamber, which is the main sign of uveitis, inflammatory cells in the anterior chamber. And this we try to calculate or نحاول نحسب عدد السيلز بالانتيريور chamber حتى نقيم اليوفيتس into mild, moderate and severe حسب عدد السيلز اللي راح نحسبها بالانتيريور بعد او بالفيتريوس body. الشغلة الثالثة اكو يسموه الفيتريوس فلير مين انه صار defect بالسيلياري membrane، بالسيلياري يسموه blood aqueous barrier and صار leakage بالبروتين, and there is a precipitate of the proteinous material in the anterior chamber, and this is result in what is known as the flare in the anterior chamber.